I don't think you have an anger problem. I think you have a sadness problem.
Wow. I came here to do a podcast. I got a therapy session. What would you say are the biggest misconceptions about trauma that you wish people understood?
The biggest one is that it can only happen during military combat. Emotional trauma can happen at any point in time. It is this hugely widespread issue. I think a lot of people have this idea of I need to be tough or I need to have a strength, and part of being strong is not identifying with the concept of trauma.
Oftentimes, trauma goes unnoticed until you start to wonder through therapy, through reflection, why am I acting this way?
Shame, fear, and sadness, those emotions tend to be what live underneath a lot of anger.
I should have done better. I could have done better. If I put a little more effort in, I could have showed up the way I wanted to, in a way that makes me proud.
You're not in your best headspace, showing up and believing that you should be anyways, and then shitting on yourself because you're not. When you notice anger show up, I want you to ask yourself, why am I really sad right now?
Once you recognize that, what is the best way to process and overcome those feelings?
I think in the healing process of trauma, we'll start to see differences of...
Welcome to Light Within. We are so excited you're here.
But before we dive in, we'd love to ask you for a quick favor. We're a brand new podcast, and your hitting subscribe would mean the world to us. So please take a moment to hit subscribe, like, comments, and help our team bring this amazing content to you every single week. Thank you. And now back to the episode.
Lauren, welcome to Light Within. It's truly an honor to have you here.
Thank you so much. I'm excited to be here.
We're so excited to have you because the topic of trauma is so dear to us. Many listeners may know that we grew up with a single mother who really struggled with depression. We went through our many sets of traumas as well. And now I'm coming to realize that this concept of trauma might be even too narrowly defined. There is so much that goes into this concept of trauma that can affect us for a very long time. So we'd love to hear from you. How do you define trauma yourself? And what's the best way to think about trauma?
Yeah, I think that the general kind of consensus on what trauma is, I think has really developed over the course of the past decade. In the Diagnostic and Statistical Manual of Mental Illness, we kind of think about a traumatic event as something that has real or threatened kind of violence against your life or somebody that you care about. And over the course of the past decade, I think what we're coming to realize is that it's actually also important experiences that have been dismissed or invalidated, or other experiences of just harm that's been caused. And I think about trauma more in terms of the impact that it's had on the individual than on the definition of itself of the event. Because there are certain things that in certain contexts, like certain forms of bullying that have a really profound impact. Maybe they weren't violent episodes of bullying, but somebody, calling somebody a name in the kind of play yard with a bunch of other kids, I think can have a really profound impact. Let's say if that's something that gets taken and repeated over the course of time. And so we're starting to see how much these experiences are usually relational that can end up really impacting the individual. How much does this person think about this event in their life, and how much impairment does it cause? Has it completely shifted their sense of self? And once we're starting to think about kind of how it's impacted somebody, we can start to think, okay, so this was actually a really profound moment in their life that has maybe shaped or changed the course of the way that you see yourself. I'm sure you can all think of those moments, even as a kid, of those early developmental experiences of, I had never thought of myself as, X, but then somebody said it to me. And then, things catch on usually pretty quickly when you're a kid. That can be kind of the foundation of how you start to see yourself. And that's really where I see the trauma happen.
Well, I feel like that's such an important point, that trauma isn't necessarily something that violates you physically, but it's something that happens that could change the way you think about yourself. And I feel like oftentimes trauma goes unnoticed until later on you start to wonder through therapy, through reflection, why am I acting this way? And it's usually a result of trauma. And your focus on impact is really a critical point.
Yeah, but it definitely is that way where we sometimes don't really realize it, or we think this is just how everyone sees themselves. And so we don't really have a great way to understand, is the way that I'm seeing myself kind of normal within the kind of in the normative human experience? I'm sure it is to some degree, but how does it differ from other people's based off of kind of negative kind of early developmental experiences or even things over the life course. And the other big piece about the impact is that it can also change the way we think about the world in general, in addition to the way we see ourselves, but in the way we kind of anticipate what our futures could hold.
What would you say are the biggest misconceptions about trauma that you wish people understood?
The biggest one is that it can only like happen during military combat. I swear it's one of the biggest hurdles. Like there's a PTSD questionnaire that I give out online. And for the most part, it comes back every single time I send it out to people, it comes back with a 0. And I know it's not a 0 because one of the first question is, have you experienced trauma? And everyone says no, because they have like a really narrow definition of what it could be. And so when I say forget about kind of your perception of it, I just want you to answer the questions. And then I get a very different set of results. So I think it's that like a narrowly defined idea of what it is, or that like defining something as trauma means that you can't heal from it, or it's going to stunt your recovery. Like I think a lot of people have this idea of like, I need to be tough or I need to have a strength. And part of being strong is not identifying with the concept of trauma. It makes people feel like they're going to become more stuck in some way, which is never really the case. It's just if I have a name for something, then I can begin to figure out what to do with it.
Yeah, I wonder what the best way is to help people realize like, hey, there are trauma probably affecting you. What would you recommend to people to start maybe recognizing that in their daily lives?
I think the biggest one is starting to think about what have been the most pivotal moments in your life. And just starting to ask those questions. And even if you don't feel comfortable with the label of like, and obviously some of the pivotal moments are good, right? Like of just, the birth of a child, of like marriage. Some of those things can be good. Some of them can also be, the loss of a loved one or, something else happening in life, and starting to really kind of unpack what have been the things that have changed you most. I think of just kind of questioning and starting to explore a little bit more. But as we dig into our own histories, what we start to see is like a kind of a constellation of factors to influence our like development over the course of time. And so just being able to start to take a look at those and being like, how did this impact me? Things that tend to come up in your mind a lot, like we're not really good at hiding stuff from ourselves. And so there might be something you're like, I have no idea why I'm still thinking about this one thing that happened 10 years ago. And it could be something that was like, moderately shameful that happened. And you're like, what is it about that event? And starting to get curious. I think curiosity is usually the best way to start to approach any type of like kind of traumatic experience, or like to start to understand, and then to see like kind of what is needed to unpack that.
I see. So for the people listening, it's about really digging deep and thinking about, what are the most impactful moments in your life?
Yeah.
And then starting to think about, how did that actually affect me? And how is that affecting me now?
Yes.
Whether that's change in behavior or actions. Is that correct?
Yes, exactly. And you can start to ask like, when did I start to see the world like this? Like a lot of people, if you have that like kind of a very negative view on people, like a common phrase in my sessions is like, I hate people. And or like, it feels very much like French existentialism, like, hell is other people sometimes when I'm in session. And it's like, when did that thought get reinforced? When did it first start showing up for you? So looking at the kind of the origin points, and then it's usually pretty clear. People are like, well, I stopped, thinking that people would do good things after an event happened. And then we can kind of start from there.
Let's say for people who say, I hate people.
Yeah.
Is it mostly digging deeper and thinking about the things that you would like to change so that you can go deeper? Or how should people think about, what to explore?
I usually start asking like, when's the first time you had that thought? Where did it come from? Is it something that like was kind of given to you over time, like just like in your family system, like that something that people just said? And usually it's a combination of factors, something that people said, and like my own experiences interacting with the world of, just seeing someone do something horrible. And then that starts to kind of shift your impressions. And so I start to just kind of ask, where did those thoughts start coming in? And when did you really believe it? And I always ask everybody, I call it the umbrella question, which is like, what percentage of you believe that to be true? Okay, so do you use umbrellas?
Yes.
Okay. It's actually a more controversial question than you'd think. Because some people don't. But at what percentage chance of rain do you bring an umbrella?
40%.
40%? Oh, that's good. How about you, Dan?
Oh, like 100%.
100%. Okay. Yeah. So
Yeah.
I always ask that because I want to know, based off of those kind of lines, at like what point do you start believing something to be true? For me, it has to be over 60% because I find it really annoying to carry. And so if I ask somebody that question, then I ask them, like, how much do you believe this should be true? And they're like, like 100%, then I know that there's a huge estimation of how important this thought is to them. And obviously, like, this is like, doesn't always correlate of just how much people care about kind of getting wet. When I think about that, of just starting to kind of think through like people's perceptions and how much they really buy into something. Because if it's a thought that doesn't really bother them, they're like, I hate people, but like, I don't care. I like have a network of people, but there's times when it really kind of isolates people. And that's what I want to get to know is like how much it's like contributing to a level of isolation, impairment in daily life. And where does it go back to? Because sometimes there's very like kind of a clear like moment in time where someone's like, I saw something happen and then it completely changed my view of the world.
And would you say from your experience, this concept of emotional trauma is much more common than physical trauma?
It's interesting because I don't know. Sometimes I don't know if it's a reporting bias because people are really hesitant, especially in the United States, I feel like, to report physical violence, like kind of perpetrated by a partner, a family member, or like just anybody. Like there's a lot that goes into it. But I do think that emotional trauma can happen at any point in time. It is this kind of hugely widespread issue. And when in my studies, like we definitely see high levels of verbal or emotional abuse, more so than anything else. But I never know if it's solely because it's that much more prevalent or if it's because we don't like to report the physical violence.
Yeah, and even from my personal experience, when I experience something emotional, I'll usually kind of like cover it up or dissociate from it. So I might not even recognize that it's been piling up.
That's an easy thing to do because I think we can also deny it. We can deny that it existed. And dissociation is one way of doing that, right? We learn over the course of time. It's safer to actually not be here. And so when someone starts to emotionally escalate, then we just kind of leave the building emotionally.
What are some other ways that people hide it?
People like straight denial is cool. That's a fun tool that people use of just being like, it didn't happen. Some people who tend to like say things that are emotionally abusive, like cover it up with the kind of someone who's perpetrating it, covered up with, I'm just being honest. But there's definitely a difference between being honest and being cruel. And so I think sometimes people are like, no, like people like this person's just being honest with me, of trying to kind of defend the person who was like making those statements in the first place.
Wow. Now that you say that, I feel like I do a lot of that myself. It's like, kind of explaining the situation and kind of hoping I would feel better, but it actually ends up invalidating my feelings and not actually spending time in processing.
Of course. Yeah.
Yeah.
It becomes like self-gaslighting. Like you're telling yourself that it's fine. Like they didn't really mean it like that. And if we can just honor the impact of what somebody said, I mean, sometimes it wasn't an intentional harm that was caused, but by denying the fact that it had an impact or that there was something messed up about it, like we're denying the fact that that it was harmful, and that's not fair to us.
Why do people, even your loved ones, friends, often invalidate trauma that you believe to be true?
That is something I think about all the time because I feel like people are, for the most part, well-meaning with like some very clear exceptions, but for the most part, people are well-meaning and they don't want to cause harm to other people. And yet we do. And I think sometimes it's somebody's own discomfort just with like the content itself of like, I don't want that to be true. And if you think about like, when's the last time one of you have either of you been invalidated lately?
Absolutely.
I'm sure.
usually by myself, now that I realize.
What have you invalidated?
I think I constantly tell myself, this person probably didn't mean it. Or let's say my partner is struggling with something. Hey, don't worry about it. Or hey, take it easy. So kind of brushing things off.
Yes. And why do you think that those statements are made? Like, why do you think you tell yourself that?
I feel like it's more efficient. And also, for some reason, I believe that if I brush it off, it won't affect me.
I wish that were true. By the time we're analyzing what somebody's saying to us and telling ourselves to like, just don't worry about it, we're already worried about it. So it doesn't usually work. But yeah, I think similarly, other people do the same thing to us. And we tend to mirror aspects of our invalidating environments that we like kind of over the time we've learned like, oh yeah, you should just tell yourself that's fine. And like not something to worry or care about too much. But I think even just being able to pause, even if it's something small in the kind of scheme of invalidation, like we can have like a small like kind of moment. Like my dogs are like, you know, sometimes they do prefer my husband to me, which is kind of rude because like, I don't know.
Very weird.
Yeah, I don't like it. But even just in that small moment of like, I like called my dog Lola over and then instead of coming to me, she just went to my husband. And I was like, first of all, rude. Like that's like totally unnecessary. But even in something that small where I can tell myself and be like, it's stupid to care about that. But just being like, oh, that's hurtful, Lola, you small chihuahua. Like, you know, I think being able to have that moment and just, it's not something that ended up bothering me in the bigger picture, but being able to just be in touch with the impact. But I think that there's such a hesitance to do that of not wanting to be overly emotional or overly like, or have too many feelings.
So how do you balance that? You know, for me, if I'm going through a hard time, you know, maybe it's from a traumatic event in the past, but I also want to be empathetic and compassionate towards myself. So how do you balance the two?
I think the best way is to just honor the emotional experience. Like, obviously, like, I think all of our emotions are valid. And it's just sometimes their intensity is too high to be helpful. And so when I think about that, if like I still might want to make a change, and obviously, if after my dog Lola blowing me off, I like didn't talk to her for 3 days, that would be weird because hopefully she doesn't talk back to me at this point. I think that like there is the like kind of range of our own responses of being proportionate. And so if I think about being proportionate with the situation is if you're going through a generally hard time, everything's going to hit you harder anyways. It's one of those things where like when one thing happens, you tend to see everything through that same lens. And from an evolutionary perspective, that makes sense. If you're being chased by a bear, you don't want to like be able like just stop for coffee because you forgot. So I think that like if there is something kind of going on, being able to allow yourself to feel the emotions and like in the way that you need to, and being able to kind of set time aside and being like, yeah, this is going to be a harder few days. And I always say of like setting some time. I do it for grief a lot of like having people set grieving time, but having set time to really kind of reflect on whatever is happening. There are some things that I think are hard for other people to validate and just knowing kind of where you are. Like the other piece is really knowing your audience to make sure that you're not going to withstand further invalidation. There are some things that people can understand quite well. And there are other areas where people feel uncomfortable.
Lauren, I know you're so professionally trained in many sorts of evidence-based interventions like ACT, DBT, CBT, just to name a few. We love your expertise and wisdom on what some of those interventions are and how people can maybe get started with those.
Yeah, of course. So all of the interventions I typically use are part of like the third wave behavioral interventions that incorporate some level of mindfulness. For dialectical behavior therapy in particular, that is a treatment that is based off of being able to treat emotion dysregulation. And we do that in a variety of different ways. It really kind of came out of a lack of an effective treatment to treat borderline personality disorder in particular. The treatment developer, Marsha Linehan, had done a few different intervention trials trying to find the best way to kind of support people with that diagnosis or that constellation of symptoms. And what she found was that people needed something that encompassed both acceptance and change. And so kind of intrinsic to the model is this concept of dialectics. Now, the story goes that she was sitting in her office talking about this problem that she was having, that like a change-oriented treatment and acceptance-oriented treatment neither worked. And her assistant, who was married to a philosophy professor, said, you're talking about the idea of dialectics, the two things that seem like opposites can both be true. And it comes from like Hegelian philosophy. So she started kind of bringing those things together. And so In all of DBT, we're balancing acceptance and change. Acceptance, really kind of that validation of people's emotional experiences and how do we change what they're doing with it. And so that change-oriented behaviors of being able to learn new skills, being able to manage our emotions differently. The DBT model is comprised of both skills of helping people kind of learn new ways to respond to their emotional experiences, interact with other people, and also being able to actually just kind of accept our own experiences and practice self-validation. And so the DBT model is kind of comprised of individual therapy, phone coaching, where you talk to your therapist outside of session to get support around things that are happening in real life, group therapy, and then also therapy for the therapist. So as a DBT therapist, we all have to do a consultation team meeting to make sure that we're not fucking it up. And that over the course of time has kind of expanded in our understanding of its effectiveness and is used for like personality disorders, mood disorders, and substance use disorders, eating disorders, but it has a smaller evidence base for things like anxiety and also in the treatment of trauma alone. So at this point, Melanie Hardin has actually added to the treatment model and added in prolonged exposure therapy for treating PTSD. But other things like cognitive behavioral therapy is much more that change-oriented psychotherapy where we're really trying to see like where are people's thinking patterns getting them stuck. And so are there contingencies in people's minds of like, I just can't do that, or I'm unworthy, and more that kind of classical response to this way of thinking is ineffective. Let's find a more effective one. And then things like kind of acceptance and commitment therapy ACT, that's much more kind of founded in values-based action and is more pragmatic philosophy towards the world. Because I think a lot of times it's hard to get that intrinsic motivation for changing thoughts and those things. And sometimes like, even if people have like, they might have a lot of evidence to support whatever negative thought there is, but sometimes it's just still not effective. You can give me like 100 reasons why you suck. Thinking that you suck doesn't actually help you in any way. And so finding that like another reason that you want to like kind of change that thought, even if you still think it's true, we kind of get out of the true or untrue and we kind of enter into the territory of what's effective in my life right now for where I want to be in the world.
I feel like there's so much power and wisdom here. I'd love to dig into maybe the first concept of DBT.
Yeah.
What does a typical DBT session look like?
There are a few different stages to treatment. And so there's a pre-treatment stage where you're getting someone to just buy into DBT therapy. And that's like kind of its own set of sessions where you're just, usually when people are coming into DBT, it's because they're engaging in a lot of like high-risk behaviors. We have a hierarchy of behaviors that we cover: life-threatening behaviors, therapy interfering behaviors, and quality of life. And the idea is you can't do treatment if you're dead. So like that's why we try with those life-threatening behaviors first. And then you can't do therapy if you're not there. So therapy interfering, and then quality of life. And so usually like the hierarchy of treatment goals is to get people to reduce suicidal ideation, suicidal behaviors, self-harm behaviors, or other like high risk. There's some forms of substance use or that are higher risk than others, of like not using clean needles, like those kinds of things. And so we're targeting those first, and then entering into any therapy interfering behaviors. Like a therapy interfering behavior can happen on my part or the client's part. If the client's not coming to session, or if I'm not coming to session, that would, both those things would interfere. And then quality of life are things like depression or maybe like interpersonal issues. And so we want to get agreement on how we're going to target those behaviors and in what order. And that's a lot of what the work is to start. Once we kind of exit that area and we've had that agreement, then we can go into the treatment. And so usually people in a DBT session, we're like tracking specific behaviors. And then once that tracking system is done, then we review it together and we identify like kind of collaboratively, what are the things that we want to talk about? And so if self-harm happened that week, then that's usually the first thing on our agenda. We have a very structured way of talking about self-harm and then getting into kind of other things of like, what are the things that led up to that behavior and how do we change it? And then that's where like I would do some skills training and like kind of support people in that process.
What would you say are the biggest hesitancies or roadblocks for people to get started with DBT?
I would say that a few of the big ones are, one is just financial, because that treatment just tends to be inaccessible. And I think obviously there's issue with healthcare and insurance and all of that. But I would say that financial is like a big obstacle of making that type of financial commitment, because usually there are very few programs that accept insurance. And so that tends to be a big one. But on the more kind of intrapersonal side of just like kind of what someone's doing, it's hard to going into a therapy where you don't get to decide what is talked about. Like we can't ignore things. So if I'm looking at somebody's, we call it a diary card, the self-monitoring tool, and somebody has engaged in a suicidal behavior, we have to talk about that before we talk about anything else. And so that takes a lot of buy-in, because for the most part, you know, when you go to therapy, you get to choose the topic. It's not like if I want to talk about my mom for 45 minutes, like, you know, that's what I'm paying to do. But in this model, we're really focused on creating that hierarchy. And so a lot of people, look, I know that happened on Monday, but like I had this like really intense thing happen at work. I don't want to talk about that right now. I'm not going to do it. That's where that pre-treatment comes in, of like getting somebody on board with this model, because it's not common that happens, especially when you're an adult. Like you can kind of talk about whatever you want anytime, but that can create some tension. And I think also there's the stigma around being an adult who needs to learn skills, like especially emotional ones. It feels like stuff that we should just have. And that one tends to be hard for people. Like, you know, someone being like, I'm 45, I don't need you to tell me like how to regulate my emotions.
For the people listening, you know, I'm curious why would they choose DBT versus other ones if they know the trauma that they want to heal from and they know what they want to talk about?
So I think it would just come down to, there are things that interfere with your ability to process your trauma. And if there's a lot of behavioral dysregulation, let's say I can't stop self-harming, or there are things that get in the way of you being able to address that effectively. And we want somebody, usually the way I think about it is like, we need you to stay alive to be able to process your trauma. And so if someone's having a lot of difficulty, you know, like they have such strong suicidal ideation, we want to get the behaviors down so they can do that processing work. And that's when it really does become beneficial, having that hierarchy, because then we can kind of collaboratively work together and be like, we both want to get there. I would much rather talk about trauma than this other thing, but we have to address this, whatever the behavior is that's getting in the way. And it helps them be more equipped to process trauma. Because when I do trauma sessions, oftentimes people are narrating the exact traumatic event several times in the session. Part of prolonged exposure is that narration of whatever the traumatic event was. And so they need to be able to tolerate it. And so learning the skills to be able to tolerate it. I mean, the most dangerous thing that we can do as clinicians is have somebody just tell us about their trauma and not teach them what to do with it. And I think that's really oftentimes something scary in the assessment phase of a lot of kind of early psychotherapy, is having somebody get too far into something that you haven't actually unpacked. And so people learning the skills to be able to tolerate their emotional experiences and to be able to learn how to talk about something in that way is really beneficial.
Is DBT mostly for very extreme traumatic situations, or could that be applied in a more day-to-day situations as well?
Yeah, it can be, I think, across the board. Like, I definitely need to use my DBT skills all the time. Like, sometimes you're in the supermarket and someone's like in the like fast lane, but they have like 45 items and you're like,
DBT time.
Yeah. You're like, it's not effective to go up to people and be like, I noticed that you have 15 items and it's a 10 item limit. Like, let people live. Like, being effective versus being right. Like, yeah, technically I'm right, but just let it go. Like, there are things that are helpful day to day and just kind of improve your general interactions. Or even things like, there are some times when, you know, where you probably don't feel like being validating to someone, and then being able to be mindful and be present. There are things like that, just like everyday things that we all encounter. And I think DBT has been incorporated into, sometimes like historically I've done like kind of trainings at like organizations that they're like, we want to kind of enhance our mindfulness practice and incorporate some of the DBT skills. A lot of times people don't need all of them, but yeah, I think most of them can be applied across contexts.
Would you be able to show us like a few minutes of a potential DBT session?
Yeah, of course. Who's my patient?
Let's say,
I'll do it.
Oh,
I'll do it. Yeah.
What are the behaviors that need to be worked on?
Oh, all right.
A lot.
This is live. All right. Let's say managing my anger.
Yeah. When's the last time you felt really angry?
Last time I got really angry. Maybe like a month ago.
Yeah. What was going on?
I think I was frustrated with myself.
Mm-hmm.
Whether that's not meeting expectations or thinking I should be at a certain point in my life that I haven't reached yet.
Yeah.
So, it's anger mixed in with disappointment and even, some sort of sadness there.
The way that it was coming through was of not meeting expectations.
Yeah, not meeting expectations, not being where I want to be yet with the vision that I had in my mind, and feeling a bit sad along with that as well.
Yeah. How did your anger present? Was it thoughts or was it behaviors?
I would say both. It definitely started with the thoughts, but the behaviors, I can see myself being more closed, not being as open towards people, isolating more.
Was there a specific moment that you feel like really represented? Because sometimes when I'm thinking about these kinds of situations, when there's an increased experience of anger, like having kind of like a burst, like when did you think that the anger hit its peak?
When I wasn't showing up in my daily life as I wanted to.
Yes. Was there a good day that's representative of this?
Let's say I had some meetings. I was already frustrated with myself going into that meeting. So during that meeting, I wasn't as friendly or as empathetic towards others. And after the meeting, just taking a long break just to like isolate myself, just to like, gather my thoughts and get back up. Yeah.
What does it feel like to you to not be your full self in the meetings? Does it feel like, did you feel angry at yourself because you also like, did it enhance your anger?
Oh yeah. I mean, I want to show up as the best leader as I can. And when I don't do that, I am definitely hard on myself. So it's a vicious cycle, right? I don't show up perfectly and then I get more angry at myself, which in turn, just goes round and round.
Yeah, absolutely. And so this is really interesting. So what we might do in a DBT session is we might look at a chain analysis, which is we might say what happened. So maybe like a specific date that you had a meeting, we would take a look at it and say, how did you feel? What was the prompting event for the emotion? And the prompting event, it sounds like, is actually being in the meeting, realizing that you're not showing up as your best self. And so we want to take a look, and we usually take a look at these kind of moments in isolation, and then we can kind of generalize them later, because typically people tend to have like 4 or 5 different chains of like their emotional experiences. And it sounds like the problem that you're really wrestling with is not anger, but actually disappointment that you process as anger.
Oh, wow.
And it sounds like you don't really experience the disappointment part or the sadness, but you feel the anger. There's a reason why that is. And I think that we can and that's one of the things that we would probably dig into, is trying to understand where that vulnerability came from. Like in your childhood, what emotions were reinforced at home?
I would say positive.
Yeah. And so what happened to emotions like sadness?
I just never really showed it. I think I have trouble being vulnerable, even to this day. And I think that I would be able to just handle it on my own in isolation, just by taking time off or just by exercising.
And so a very pragmatic approach to the emotion that doesn't involve a lot of feeling it. And so I think that, and one of the things that often happens over time is that anger is actually more effective. It activates a different part of our brain. So it makes you want to do something. Because what you're talking about, it sounded like you were like, the anger towards yourself for not living up to expectations. That sounds like sadness to me. That sounds like disappointment. But oftentimes with primary, secondary emotions is that we miss out on the primary and we end up with just a secondary. And when you get upset with yourself for not showing up as your best self, what are the things that you say to yourself?
I should have done better. I could have done better. If I put a little more effort in, I could have showed up the way I wanted to, in a way that makes me proud.
As we're talking about it now, and you think about a time that you didn't show up as your best self, was it really effort that got in the way? Like, you just weren't trying hard?
I would say sometimes.
Yeah.
I would like to think, I'm aware of emotions. So I'm aware when I'm angry and when I'm not showing up. And there are days where the motivation or the effort isn't quite there. So even if I know I'm not showing up the best, I kind of just let it happen that day.
And is it like, do you feel like you're doing the best that you can on that day, given that emotional set of emotions that you're experiencing? Because our capacity changes day to day, depending on where our vulnerabilities are.
I would say no, but if I'm putting myself in that moment, I would say yes.
Yeah. And I think it's because like none of us want to admit that we're not our best selves. Like, I don't want to admit that. Like, of even just like reflecting on a session, being like, oh God, that wasn't my best session. Or like, I could have like kind of intervened here. Like, I don't want to admit that because I want to be perfect all the time. But there might be things like, if we think about the vulnerabilities to things, and one is like our own denial that our emotions impact our performance. And I think that sounds like kind of one of the things that you're wrestling with, is basically of knowing that you're not in your best headspace, showing up and believing that you should be anyways, and then shitting on yourself because you're not. And if thinking about those three kind of facets of it, where would you intervene?
If I notice it becoming more and more consistent and it starts to become a problem.
Because I don't think you have an anger problem. I think you have a sadness problem. How would you treat that sadness problem?
I would dig deeper, understand where it's coming from, think more about my childhood.
Like, even just as we're talking, I'm thinking like, when you notice anger show up, I want you to ask yourself, like, why am I really sad right now? And starting to do that. And I think of just noticing when we notice anger showing up, because there are a lot of times where it's not really the anger that's important, and being able to kind of look beyond that and seeing it as sadness. And I think sadness has a value because it's actually a lot easier to validate. Because even if you think about in your relationship with each other, when you come at each other with anger, is it harder to have a conversation than if one of you was like, I was really hurt by this? I have siblings. I like to come at them with anger first. And then,
it's easier to show with anger.
Yeah, it's so much easier. And it's like kind of acceptable, I feel like, in sibling relationships to be like, somewhat angry towards them. But I think as we do that, of just noticing the difference, because secondary emotions are a little bit more wild because they're actually not what we're feeling. They're harder to deal with. And so it's harder to process them because that's not really what's important.
This reminds me of when you're fighting, let's say with your partner, when one person expresses vulnerability and expresses their true feelings, things start to sink between the two people. And what you're describing here is almost like being that empathetic, vulnerable self to yourself so that you can feel your sadness.
Yeah. In a partnership, if I come at the situation with anger, that's what I'm going to get back.
Yeah.
And that's rarely what I'm looking for. It's a lot harder to resolve a situation when the emotionality is really high. And if typically the primary emotion is more regulated. And so if I was disappointed in something that happened with my partner, but I come at it with anger, like one of our dogs has a little bit of a weight problem. She's really cute, but it's been really hard to keep her on on a regular diet. So the other day we both fed the dogs dinner because the dogs act like they've never been fed before in their life. And I was upset because we have Lola on this like strict diet. But if I came out and I was like, I can't believe you did that, versus I'm just really worried that like this one meal is going to, change the course of her. Like she's going to get diabetes. I don't know, whatever my worry thought is. It's a very different conversation, because the first way I could come across as like the other person's going to be defensive, right? My husband's going to be like, well, I mean, you did it too, which is true. Like we both kind of engage the same behavior, and it's going to kind of escalate the emotion versus just like, oh, I feel like disappointed or worried. And we can come at the conversation a lot differently but it's just having enough insight and awareness of like, this is my typical pattern. I think most people do. Anger does come at the forefront of the emotional experiences. And there are a lot of ways in which that gets reinforced over the course of time.
Mm-hmm.
Wow, this was so powerful,
Oh, good.
Well, first of all, thank you. I've talked to a lot of therapists in my life, but I've never heard of it being described as a sadness problem. I really kept on trying to dig deep
Yeah.
into like, why am I angry? Or like, why am I disappointed?
Mm-hmm.
But, now looking at it from this point of view, I do think I have a sadness problem because I don't like to show it. I don't like to feel it. And, that's what I really need to dig deeper into. So I really resonate with, what just happened here. I came here to do a podcast. I got a therapy session. I mean, that was amazing.
I'm glad. But I think it's hard to, and that's what we do in DBT, right? Is that we want to look at the problem, but then really kind of get an understanding of what's happening and contributing to it, like kind of beyond the basics. Like I think behavioral therapies sometimes get a bad reputation for being robotic, but really what we're doing is we want to kind of understand like kind of a funnel approach of like, this is what we're seeing at the top, but what's coming out the bottom? And like where did that kind of substance come from? And so I think it always helps me of like just starting to kind of understand of like, why did I have that reaction? Like anger is justified if it's if our goal is being blocked, but it's not as common as other things.
So for the people listening, if they do feel, let's say, anger as their main thing, it's really about digging deeper to understand what is actually that primary emotion that is actually causing these behaviors or these thoughts to be able to really change that behavior over time.
Yes. And some of the like big primary emotions that I see are things like shame, fear, and sadness. Like those are, or guilt. That's another big one. And those emotions tend to be what like kind of live underneath a lot of anger.
I feel like I definitely struggle with things like shame and guilt a lot. Once you recognize that, what is the best way to process and overcome those feelings?
Shame and guilt are like in particular, it's being able to think about like, if we go even deeper into kind of what is shameful, what is guilt, like, because what I want to understand is there something really shameful actually here? And because similar to what we're doing with sadness, because sometimes people have a generalized shame response of like, and sometimes I think it's an over accountability problem where people, when bad things happen, they just blame themselves because it's easier than kind of accepting the uncertainty of the universe. And so sometimes like if something bad happens of just being like, I'm unlucky, or like, just kind of creating a response where like you have more control over the situation than you actually do. But if there is something shameful, like where do you think that your shame comes from?
For me, a lot of shame comes from the fact that I wasn't proud of myself as a kid. I was very emotional. I didn't have much social skills. And whenever like an event reminds me of kind of how, let's say, unproud of myself I was, I think that triggers a feeling of shame.
And that makes so much sense, right? Like of like kind of coming back to it. And when you think, is that actually shameful? Like, because I think that there are probably ways in which people made you feel shame about that. But when you're telling that to me, and if you were like looking at a kid now, are those actually shameful things of areas of struggle?
No, not at all. I think I should kind of see the situation with empathy and really make them feel validated. My kid self feel validated.
Yeah. Yeah. This is like, it's hard. And it's hard to know. I think that especially having some kids are just like super sensors. They just feel things more deeply. And it's probably something, and I imagine in other ways, it's probably been helpful to you, like having like a bit more of a super sensor, probably like it's one of those things that makes you good with people. That like when you have like a lot of emotions and you can kind of feel things that maybe other people can't. But I think, as a kid, we just want to be like everybody else. No one wants to feel like an outsider. And so we can really kind of, I think the part of this is like kind of in that healing process of that younger self is being able to really understand where that shame's coming from. Like, of course, like no one wants to feel like the weirdo, but being and having like difficulty. Why do you think you had like social stuff was more difficult for you?
When I was very young, I was definitely a super sensor. I don't know. Everything just kind of made me sad or afraid of people judging me or doing something wrong. And I would just feel immense pain.
Yeah. So there was a lot going on internally. Like your internal experience was intense. And so it sounds like it was just harder because there was a lot of different things happening within you, that it was a struggle to like, communicate because you're thinking about how they're perceiving you. There's a lot of stuff that's getting in the way. It sounds like anxiety. Anxiety was high, so it made it harder to communicate. And that feels really painful. And so what I might say is like, one of the things I often think about is being able to like kind of sit in that of like, what did it feel like to have that pain in that moment, and being able to stay there and seeing where that emotion sits in your body of like, oh, that feels like, yeah, that feels really isolating. Like I can imagine feeling really isolated and just feeling alone, and being able to validate your experience of like, and that of course it became shame because it didn't feel good. And I'm sure were kids super nice about it when you were having trouble?
Thankfully, I don't feel or remember getting bullied because of my sensitivity, but I do remember feeling like I was different and I wasn't as good as
Yes.
others.
And it's easy how early on we learn that difference means like we kind of translate it as not as good as. That's pretty early learning to have that. And so I think that like being different as a kid wasn't fun. And being able to kind of stay there. And of course, as like kind of a coping mechanism where like we just kind of develop other ideas of like, so I'm probably not as good as other people. And that just like kind of puts us in the shame box. And so it makes a lot of sense how we got to shame.
Wow.
And so shame is a really old tape for you. And so I think being able to get curious about like, is there something actually shameful here? Or am I playing out that old tape because it hasn't been resolved?
Mm-hmm. I really appreciate that because even with my partner, when I was able to recognize some of the sensitivities that I have, and instead of, as you said, showing up in anger, just being transparent and vulnerable that, hey, I was this person when I was younger. And that leads them to be able to accept me and provide safety. And that's what kind of creates that connection again.
Yes.
Yeah.
And I think in having a different experience is actually one of the best treatments for like any type of like trauma is being exposed to the emotions yet again, but having a different experience of safety in response to it.
Wow.
And so those real life moments, I think we start to create a new context of self.
Wow. So how would people know if they've worked on themselves, if they're truly healing or just suppressing or avoiding their trauma again?
Yeah, this is always difficult, right? So I think about how it comes up in day-to-day life and like, what is the way, just think about the way that like kind of emotions show up. And, I think in the healing process of trauma, we'll start to see differences of being able to have space between a thought and an action, or a thought and an emotion and a thought. Once we have that kind of increased distance, because sometimes I think with unhealed trauma, we just kind of, it feels like the train just leaves the station and we have no control. And so I think about it of like, how much volitional control do we have over the directionality of our behavior, of our thoughts? And so I always say we're not responsible for our first thought. That could be anything, but sometimes I'll have a reaction to someone says something, maybe I get a piece of feedback. At times, people's feedback can be really range. Someone accidentally CC'd me on an email that said, I don't think Lauren has what it takes to be a researcher.
Wow.
Which is rude. But I noticed like immediately in that moment of being like, they're right. Like I have no business being here. And that was much earlier on in my career. But when I noticed that reaction where I just believed it off the bat, and obviously like having an emotional response makes sense. Like that's a mean thing to see someone say. And obviously that person should do a better job looking at who they CC on emails. It's really about like kind of my response. And after that happened, I remember it was like, had to be like almost like 10 years ago now. I was just in bed all weekend. I just like was like, I don't want to talk to anybody. I don't want to do anything. And it was my reaction that made me realize I really haven't moved on from this. Like that's still like so close to like how I experienced, like it's still so not far away. Like I can I can access it. I felt it. I was like, kind of thought about giving up. I was like, I don't really need to do this. I should just forget this whole thing. And my reaction showed me I hadn't really dealt with it. But now, like, kind of in getting something like that, because it's not always lovely being in academia, but my reaction would be different today than it would be then. And it's like, if we think about it, yes, there would still be pain involved, but I wouldn't like completely change my conception of self. And if you think about like, I think a lot of times people have a really conditional sense of self-worth, which is another good indicator light that maybe there's something unresolved there where they're like, I can be top of the world if I get good feedback, but if I get bad feedback, then it's over. Then I hate myself. And obviously, if there's something that you know is on your mind, but you continuously avoid it, that's another good sign.
You know, this sounds really hard to dig deep into, the traumas and the feelings that really like hurt you and that make you uncomfortable. How do we balance pushing through the discomfort versus knowing when to actually slow down in trauma work?
I think it's the timing and context. Like there are times when it's not helpful. Like sometimes people have a really kind of profound realization, but it's in the middle of a work meeting and you're like, this is not the time to be able to address this. And that's really where I think the DBT skills can come in, is being able to practice some effective pushing away, of just being able to know, am I in a safe place to experience this? Because sometimes we're not. And this is something that happens oftentimes over the holiday season when people are kind of back embedded in their family systems and they start, and it's like that vibe of like they're reporting live from the scene where they're like, this is like where this occurred, and they're starting to have those realizations. But I want to like kind of make sure that people are safe enough to be able to do the work. One of the things that people always say is that if somebody has like kind of physical, emotional safety, they can do the trauma work. And so that's really the question, is like, in the right now, am I in a place where I can do that? Because if my like trauma work is going to be disrupted by someone invalidating me, or like being in a context where invalidation is occurring, it's a lot harder to kind of bounce back and forth. Like you're going to have a lot of messaging that actually your trauma related cognitions are true.
How would you describe some of the other interventions like ACT or CBT in relation to what we just talked about?
Yeah, so I think in the a CBT approach, we would definitely be we would take like kind of the same set of thoughts of like, if the thought was, I'm different than other people. Mm-hmm. And one of the interventions people do with thought log, usually on that thought log, we're looking at evidence for and against that thought being true, being able to balance it out and developing a new thought that I want to buy into. Mm-hmm. And so if that thought is like, I'm different and that's okay, or like, there's more similarities than there are differences, and being able to find something that feels true in those moments. And so that's like kind of when we think about the exact cognitions, is being able to reframe them and being able to kind of tell ourselves a different story. And it just has to be a story that you can buy into. If someone just turns a negative into a positive, they're never going to believe it. Like I hate affirmations because I don't think they work. Because if I just, it's just, it has to be something that you can actually truly believe. If I just tell myself like, you're amazing, like it doesn't really do it. Or if like, I am really good at this thing that maybe I'm not good at, like, it's not going to change anything. And so it has to be something. And oftentimes like kind of coinciding with those thoughts is like being able to have a kind of behavioral experiments of, if I like, let's say, one of the ones I was working with a client on was like socialization and like thinking about like feeling socially inept. And so we were like, okay, let's test it out. Like, how would you know that you're socially inept at this dinner party? What feedback would you be getting? And being able to test out, like, this is the like situation of like introducing yourself and someone being able to like, one of the behaviors of like someone coming back to talk to you more after you introduce yourself. And looking at those things and seeing how often that happens. And so doing some behavioral experiments to be able to see. And so for something like, I'm different than other people, it might be like, okay, behavioral experiment, like the next time you're with people, like see if you notice any similarities between yourself and them. And so kind of incorporating those things, it's very active. It's a very active intervention of like starting to see and starting to kind of develop a new lens in the world. Just with ACT, like It's a pretty like similar response. I think one of the things that I love that we do in ACT is like one of the things that's like kind of anchoring into the emotional experience first, being able to identify what the emotion is, being able to sit with it, and then being able to choose our response. And so I think, especially with what we were talking about with like shame, of being able to be like, oh yeah, there's shame again. And in ACT, we do less like contemplating the thoughts, and we do more like just identifying the emotion that's underneath them.
Are there any differences in efficacy, and how should one go about picking the right one? Or is it kind of up to the professional to choose the right one there?
There are differences in efficacy across like different diagnoses. And so if someone's meeting criteria for anxiety disorder, I usually wouldn't recommend DBT unless there was a lot of behavioral dysregulation, like somebody was like kind of lashing out like physically or engaging in like self-harm behaviors. I would say that like for something like anxiety, I would recommend CBT or ACT. And looking at the like kind of most recent literature, like I think that's probably the most important thing on the clinician, the provider side, is making sure that what you're not just like kind of throwing someone in, you're like, oh, this generally works, so like I'll have this person do this. It's just being thoughtful about what are the like aspects of the intervention that a client needs. There's a different approach. It's called a common elements approach. It hasn't gained a ton of traction, but I do think it's probably the most helpful, which is common elements approach takes the aspects of interventions that are most effective for different symptoms and takes a look at them, because there's a lot of overlap. Like even as I was describing those interventions, there's a lot of overlap between them. And so if someone's presenting with a lot of anxiety, what I want to do is I want to do exposure practices, and that exists in every treatment that's any good. And so I would want to like kind of pull together a treatment plan based off what I know works, and be able to say, this is coming from CBT. Some people like can benefit from like a full 16 session CBT intervention, but sometimes we don't need that whole thing. And so I want to take what are the common elements to have an idea of how I'm measuring it, of like making sure like I don't want the person to just kind of come back and be like not really have an idea of like what to look for. So usually just kind of creating some sort of treatment plan based off of it, but definitely there are differences for different disorders of what people are dealing with. And if someone's dealing with something that's kind of outside the bounds of like a specific mental health disorder, then being able to take the common elements of like, okay, these symptoms typically respond to these things.
Got it. So in that what was the name of the last thing that you just mentioned?
Oh, common elements.
Common elements. So that takes bits and pieces from all these different modalities and utilizes the best and most effective one depending on the situation.
Yes, exactly.
I mean, that sounds amazing. I mean, very personalized, like very, personal to you.
Yeah. And it's different. Some people, my like number one pet peeve is when someone tells me they use an eclectic approach, because that means they don't do anything. Because there is a lot of like similarities across interventions, but there are also a lot of differences. You have to be really careful about doing one at a time. Like there's some situations where actually we want to have exposure to the emotion itself, and other situations where we want to have exposure to a specific set of like behaviors or experiences. And we want to make sure they shouldn't overlap. And so this is like, I want to make sure that I'm using the right thing for the right kind of symptom. Like if someone's coming in with OCD versus someone's coming in with a specific phobia. So just being careful about that. And I think that individualization is like, we have enough tools to know what works now, and just being really thoughtful about that.
I know a lot of people think of therapy as just like talking to someone and just having someone to listen to. But I think what you're showing us is that there's so much research and scientific evidence behind how to treat every facet of what you might be having challenge with. There might be the most effective way to treat each of them, and that you can identify those.
Being able to do just like straight talk therapy, it's like fine if there's nothing going on. If you're like, it's kind of like having a like pretty helpful friend. You're like, you're a good person to talk to about this. But if there's something going on, then you want somebody who can really you want someone to be able to target those symptoms with you, because what we're like dealing with is like human suffering. Yeah. And if somebody's not suffering and they just want to like a place to maybe talk through, I think this is something that comes up a lot with like kind of work related stressors that maybe you can't talk about with like, maybe there are issues of confidentiality you want to talk to like somebody about and just kind of get like another set of eyes on. That can be really helpful, but it's more like, I call it like sneak DBT, where you like, someone maybe isn't ready for the full model, but we're like kind of throwing it into a conversation anyways. So I think of just, there are a lot of different ways to do therapy. I'm not good at just talk therapy and not doing things. Mm-hmm. Would not come to me for that.
Lauren's always ready to sneak in DBT in the normal conversation.
Yes. I think it's very annoying for like people in my life.
Did you learn sneak DBT in your textbooks, or did you?
I actually learned it working with adolescents because I what I realized was if I use the names of a lot of stuff, then they tell me to go fuck myself, which is not an exaggeration, unfortunately. So you kind of like, you're like, yeah, I'm a cool therapist. Like and like, you just kind of like throw it in. They're like, oh, actually it was kind of helpful when I did that thing last week. And you're like, I'm like, this is the greatest thing. Like having like a 16-year-old tell you that you're like cool or you did something right is pretty amazing.
Wow. I can see it already. Lauren, founder of Sneak DBT. For someone who feels stuck, in their trauma or thinks that they'll never get better, what advice do you have for them?
I think that usually what I just start with is like, there's probably a reason for that. Like, I want to really understand why that is. And like, sometimes it's just straight up like self-hatred, and that's like one route. But I want to make sure when somebody's coming in with a lot of hopelessness that we don't jump into problem solving, because that's usually not helpful. Because it's founded in some level of evidence that treatments don't work, people aren't helpful. And I want to like, I want to get really curious about that. And so usually the first step is like starting to outline, why do you feel stuck? What is it? What's happened in like kind of life over the course of time that's made you feel this level of stuckness? And then being able to see like, okay, so if we were going to do something differently, like what would make you feel hopeful? And so I would say that first, just outlining, these are all the reasons I feel stuck. And we don't want to like invalidate the fact that that's something hasn't worked. If someone's feeling that stuck, something hasn't worked. And so then we can kind of take efforts in an opposite direction. And so I would usually say start there, of just really like assessment is key. If someone's feeling that bad, I want to look at their treatment history. I want to look at the conversation I have with them and start to pile up kind of things together and see, okay, this is why this didn't work. Of kind of developing, was it because the intervention didn't have a long enough like assessment period of like, or is it because they haven't gotten the right intervention? And starting to see kind of align with the person on why things didn't work, and then figure out together, how would it be different now?
Wow. You're like a scientist, just really digging deep and understanding exactly why something didn't work, trying out the next experiment, like the next test.
Yeah. And definitely not wanting to repeat any failed tests of we already have data that didn't work. And I think that's how we should be, because there are so many things, like if you screw up a recipe, like you're going to go back and try to figure out where things went wrong. And so we should be doing that the same way with other things in our lives.
For people who might be feeling encouraged to start therapy, or let's say for those who, what I hear often is that they tried therapy and it was a terrible experience, they don't want to try again. What would be your advice on choosing the right therapist, finding the right therapist?
In finding the right therapist, I think a lot of it is, and this is going to contradict everything else I said. What is most important is actually the relationship between yourself and the therapist. If you believe this person can help you, so you have to like have a certain kind of like rapport with them of like, I could trust this person. We have to have a good relationship in order to be able to do any of that work. Because if I think the person that I'm working with is an idiot, then we're not going to be able to move forward. So I think it's really about finding the right fit. Because that's actually the reason why I say it contradicts other things that I said, is because the relationship is what predicts outcomes more so than what we're doing, which is like offensive to like all the work I do, of like trying to like find the right treatment. But the relationship is really important. And so in I would say talk to people and see who do I feel like I can learn from and grow from? If you go to like, I don't know, a college counseling center, for example, they just kind of throw you with whoever. And, you might get somebody who's really great, or you might get someone you don't connect with at all. And so as we're doing that, we just want to start to get a sense of who is the right fit for you. What do you respond to?
How do people know if the therapist is the right fit? Is it a comfort thing, or is it a mix of many different things?
I'm a terrible patient. I just want to be clear. I'm not a good person to go off of. But when I was looking for a therapist, I was like, who is somebody that I have to respect them? I have to respect them. I have to respect their training. And I have to believe, for me, I have to know that they're going to be like about the way that they're going to approach a problem. And so one of the things that was important to me is like being able to ask, like, if I come to you with like, if I was coming to you and saying, I'm having a lot of anxiety, like, how would you approach that in session? And so some of it is just having the right, like, kind of sense of like, okay, I like the way this person thinks, but definitely a comfort thing too, because there's some kind of people that you're probably not comfortable with, and that's totally fine. And so definitely want to have some comfort. You're going to be talking about like the most intimate details of your life with this person. So you want to make sure that there is a level of comfort. And like, I think just being aligned on certain things, like sometimes people are like, I want to have a therapist who's really politically aligned, or like we have the same kind of, we came up in the same kind of area. Like sometimes that comes up a lot of like, I want to work with somebody who knows what it feels like to be kind of a woman in the South or something. And, just being able to think about kind of the experiences, like what makes you feel more comfortable with another person. And that might be what gets you in the door, and what keeps you there is like the work that you're doing together and like what you want to get out of it. If you're having a lot of psychiatric symptoms, you want to make sure that you're with somebody who knows how to treat those too. Like that's like just in looking at people's profiles. But if you're not really symptomatic at the time, it doesn't matter as much. As more like, who do you like to talk to?
Lauren, you have a very hard job, because your job is to help other people with trauma, and you're listening to their stories and, maybe even feeling them, really trying to be there for them. How do you personally protect yourself and work on your own well-being?
So it's definitely like, I will say that you desensitize a lot more quickly to other people's trauma narratives, than your own. Like just hearing something, obviously, like I'm 9 months pregnant, so I cry in sessions all the time. So there is that. So like sometimes, you allow yourself to have emotional experiences. And I think it can be very validating of someone kind of bearing witness to your own story. But usually, like, I think that the most important things that I've kind of come across is being aware of where your limits are. When I first started out in the field, I was working in foster care and I couldn't handle it. And what I mean by that is just, it was so hard working with those little kids and like, I'm working with an infant who's a trauma survivor, and it just was too heartbreaking for me. And I think if I had stayed in the field, I would just have like 100 kids, because I would just be like, I'm going to adopt all of them. And so I think I realized that pretty early on, but the most important things are the things that I'm doing outside of session, and making sure like I'm very thoughtful about even just scheduling appointments of like, I can't do multiple trauma sessions in a row. How I schedule people is really big. And then I also just like kind of life outside of work, of like making sure that like I'm seeing friends, that I'm like going to my dance studio. I like, obviously I shared like I'm a competitive pole dancer. So I like, you can't really be thinking about someone's trauma when you're upside down. I feel like that helps a lot. So yeah, those kinds of things. And I have these 2 weird little dogs that I'm obsessed with. So that helps too.
Wow. Even as a therapist, I think you need strong boundaries.
Yeah.
And similarly to how I try not to have too many intense meetings back to back, it sounds like you did a similar thing. Lauren, if you were to share one thing for our listeners, what would that advice be?
The best kind of advice, especially just thinking around mental health, is if a problem remains unsolved, that we just maybe aren't asking the right question. And so we need to be asking a different question to be able to better solve the problem. And so I think that it's most important, and not in a kind of sense of don't give up hope, but have we really kind of exhausted all options here? And I think that sometimes we have, and like our only answer is acceptance. But I always ask that because sometimes I think that we accept unrealistic limitations on our own futures because it's easier than being disappointed again. And so whenever I think about like, people who've really struggled with kind of a chronic depression that's treatment resistant, is being able to ask, have you really exhausted all of the options? And then being able to figure out the kind of the answer based off of that.
That's so true, because the questions you were asking me, even during our session today, was so powerful. It was questions that I didn't really think about, but it completely reframed, the potential solutions that I'll be looking at and rethinking just like how I think about my own anger. So it's so powerful. The power of questions. Wow.
Yes. And I think it's not very often that I think we can get stuck in our own kind of set of thinking about things of how we've been taught to think, or am I even looking at the right problem?
Wow. For someone looking to learn more about your work, where can they find you?
Oh, I have a website, Lauren. It's by just my name. And if you can spell my last name, that's amazing. I couldn't for many years. But I have a website, laurenbochicchio.com, and I'm around via email. I'm on the social media things that are very difficult for me to use because I'm old. But I think that, I'm here. And I also, a lot of my work is published. I have for my research job at Columbia.
Amazing. Lauren, thank you so much for sharing all of your wisdom and for joining us on Light Within today.
Yeah. Thank you for having me.
Thank you so much, Lauren.
Thank you so much for watching. Hope that resonated with you.
If you're watching on YouTube, please hit that subscribe button and leave your thoughts and comments.
Your support means the world to us and helps us bring these conversations to you for free. We read every single comment and we would love to connect with you there. So go subscribe. Until next time, love yourself, be kind to yourself, and remember, your light is always within you.